Okay, I would like to call the July 16th meeting of the Human Services Committee to order. Um, First agenda item is the approval of minutes from June 18th. Do I have a motion to approve? You do. Do I have a second? Bill? All in favor? Aye. Motion carried. Minutes carried, approved. Is there a privilege of the floor? Is there anyone here to speak to privilege of the floor? Seeing no one, we will go to our first proposed resolution, which is to authorize public hearing regarding a potential application for 2025 CDBG funding through New York State Office of Community Renewal. Hello.
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 Lacey Wilson, Public Health Director. Jessica Worsley, Director of Environmental Health.
Thank you. What do we got?
So this is, if you remember, we did do a public hearing last year in anticipation of applying for the same grant. Unfortunately, we were not awarded last year, so we're gonna try to go for the grant again this year. So the first step of us submitting the application is to have a public hearing. So I would like for you guys to entertain a public hearing at the next county ledge meeting in August. And I'll plan to have a resolution in August submitted also to gain your support for the actual application for that grant.
When's the application due?
Late September. Yeah.
So is this for 26 or 25, this grant?
Ideally, we would be notified of the award in fall of '25, so fall, winter, depending. So hopefully it would go into place in early '26, so we'd be able to start using it, which is okay, because we can't really do septic work in December, January anyways, so, yeah.
What is it for?
Oh, I'm sorry. So this is our well and septic system replacement. So this helps folks with, lower to medium incomes who need assistance with septic system replacement or with well system corrections.
Is it just limited to those two things?
Yes.
Do you know how much it's for? We've gotten it before, correct?
Correct, yeah, we have it before, and CRIC is typically our sub-grantee on this grant. So if you'll recall at the last public health meeting, legislature meeting, Josh Friedman from CRIC was here as well, presenting about the components that CRIC is responsible for regarding this grant.
And how much have we gotten in the past?
Our last amount was $263,000, and I don't remember the other digits, I'm sorry. And we're hoping to apply this time we'll apply for $300,000 and see where it gets us. There's certainly a need for it in the community.
Did they say why you didn't get it?
They
last time?
didn't, and we did just have our audit from the grant that we received in '21, so the last round that we did, and everything was they didn't find any deficiencies or any issues with our implementation of the grant from last cycle. So I'm not sure if maybe just more communities are aware of this grant and applying for it, and maybe there's more competition for it now, I'm not sure.
Is it like on a first come, first serve basis on who applies for it?
I don't think so. I mean, I think they, review applications and
Well,
determine.
Do you mean
mean
for residents or for?
residents applying for
Oh,
it?
Yeah.
oh, I'm sorry. Yes, so CRIC, between our department and CRIC, because CRIC has other home improvement programs that they run, we sort of keep an ongoing list of folks who have expressed interest in septic repairs. So we are actually starting to gather folks already who may qualify for this, but that's what it is you get your name in, and then, we verify the income requirements for it, and so long as you qualify, yeah, it's a first come, first serve, and it's throughout the county.
And they don't have to be a resident? Or they do? Am I getting that confused? with
They
something?
have to own the home, they have to be current on taxes, and it has to be, again, there's income qualifications, so typically those folks aren't
Aren't second resident,
correct, yeah.
because our
Yeah.
That was great.
Crossed on some, is that the same thing?
No, so that was,
That was something
that
different.
was a different one. Mhm.
All right, I won't confuse it. Okay, any other questions?
No, I was gonna ask about the income, but you already answered it.
All in favor?
Aye.
Aye.
Thank you.
Proposed resolution number 2, authorize an MOU with New York State Department of Health Office of Sexual Health and Epidemiology for participation in the 340B drug pricing program as a sexually transmitted disease entity from the Health Department.
Yeah, this sounds a lot more grandiose than what it really is.
so.
So it's the 340B drug pricing program is something that designated entities throughout the states and counties are designated by state DOH to receive these discounted prices on products like, you know, condoms, educational materials and things. And also if you provide pharmaceuticals in a community, hospitals are eligible for it, that sort of thing. It makes these products either free or very discounted for individuals in your communities. We participate in this, and we have for a number of years. All of the county health departments really do. But the history of the 340B program is a little contentious at the federal level because there were some entities that took advantage of the discounted pricing. So the federal government and the state governments had rolled it back and basically employed some new measures to ensure that larger hospital systems and things aren't pocketing profits from the discounts. And so all of us now are just subject to an MOU to sign that says we're doing things the way that we should, but we certainly have always been doing the way things that we should. So it's really just a state kind of measure that they're putting in place to ensure compliance is something that everybody is held to, not just health departments.
So it's just a new.
This is just the
new extra
formalized
step.
new extra step.
Okay. And we've had this in the past.
We've had it in the past, we just recertified. You have to recertify it like every 3 to 5 years. The county executive is the one who typically signs off on that. And we really just use it again more so for our STI and STD prevention outreach, educational materials really, and condoms is the other that we provide to individuals in the community through our clinics.
Any questions?
No questions here.
All in favor?
Aye.
Aye. Okay, proposed resolution number 3, to accept the enhanced drinking water grant funding.
So this is an ongoing grant. It's not the type of grant where we actually submit an application. This is one of those grants that New York State just tells us how much we're gonna get. So this is a multi-year grant, and we have had previous resolutions that allowed us to just continue accepting them funds without doing resolutions on an annual cycle or anything. But since it's been over 10 years since we've done the last resolution, we're in front of you today with a new resolution to continue accepting the New York State money to support our drinking water grant programs.
And this is a 5-year?
It's a 5-year grant, yep, with $128,899 per year until March of 2030. 2030, I know. So-
Okay,
I was gonna say, so we use these funds largely to pay for staffing salaries. Unfortunately, there has been a reduction since the last 5-year cycle that we had for this grant, but we do continue to use this money largely to support staffing costs.
what was the reduction?
Almost $20,000.
I was expecting worse.
Are we testing all water in the county?
So this is to support
Not
our,
wells, like not private wells?
no, this is to support our role with overseeing public water supplies. So public water supplies include everything from municipal supplies like BPU down to, you know, a restaurant that serves off of well water. So things like restaurants off of well water are also considered a public water supply. And we get involved with helping them understand the requirements, the disinfection, the sampling needs. But no, it's not for individual homeowners or property owners.
How about Fredonia? Will any of this money go towards Fredonia? Because what I'm reading in the paper, they got a serious problem.
So again, these funds are used for our staffing time, so it's our staffing time that, you know, helps educate water operators about what they need to be doing, helps educate the municipalities about what samples they should be taking, how often they need to be taking those samples. It's that supportive work. It's not us, giving money to any of the municipalities for anything.
But to your point, we certainly, Jessica's staff has spent a lot of time supporting the Freedom water system. Work very closely, it's actually a really great working relationship. Specifically, their main water operator, Lewis, is in really close contact with Jessica's team, works really well. So it's all of that technical assistance that Jessica, Natalie, a number of others in their water division, answering phone calls all throughout the day, all hours, problem solving, troubleshooting.
Any other questions?
I'm good.
All in favor?
Aye.
Aye.
Thank you.
You're welcome. Thank you. Is there any other matters to be discussed?
No, it's not a political problem.
Nothing at all? I will entertain
Yeah,
a motion
their-
to
Their
adjourn.
heads are bumping over,
Second?
yep. There's some people that still wanna keep their,
All in favor?
their old reservoir.
We are adjourned.
Thank you.
Thanks. Yeah, see you tomorrow.
It's
God
on
willing,
its
in the creek
path
all
to
right.
being resolved. It's on its way. Oh, yeah.
Do I have to sign one more? The third?
Yeah.
Oh, yeah.